here is my presentation for alcohol abuse disorders. So the article that I was assigned was Therapist Predictors of Treatment Delivery Fidelity in a Community-Based Trial of 12-Step Facilitation by Barbara K. Campbell, Alyssa Beauty, Holly E. Fusel, Priya Sirkanth, Dennis McCarthy, and Joseph R. Gaidish. So, introduction. General problem. What general problem was being addressed? The mental health world has been struggling to find therapists with the skills necessary to help treat mental illnesses. The treatments and style of treatments are also inconsistent between therapists, which has been difficult for researchers to find conclusive determinations on what styles work to help treat these mental illnesses. Context. What is the context? So, for this section, I define some of the terms that are going to be useful to know to understand the things that I'm talking about later in the presentation. So, treatment fidelity is the delivery of treatment as intended. This includes treatment manuals, intervention training, therapist certification, ratings of treatment sessions, and supervision informed by ratings. And then there's also the 12-step or TSF, which is an approach towards counseling. Prior research. What prior research has addressed the issue? So most studies have found no relationship between treatment fidelity and patient outcomes, but there is a positive relationship in circumstances relating to substance abuse. So a study found that therapists with their masters are better at treating individuals with addictions than therapists with only their bachelors. And the hypothesis. What specific hypotheses, if any, were tested in this study? So the study hypothesized that therapists with these characteristics would have higher treatment fidelity. So these characteristics include being in recovery, being an experienced addictions therapist, frequent use of a 12-step approach, positive attitudes towards the 12-step groups, and commitment to post-study TSF implementation. And method. So for this experiment, there were two different samples that were required. First is the patient sample. So 10 community-based outpatient addiction treatment programs were brought in for this program. So 471 total adults abusing stimulants, either seeking admission or already enrolled in outpatient treatment. And then these adults were split into two groups. So the first group was treatment as usual, or TAU. It was 5 to 15 hours of weekly treatment. And then the other group was TAU plus stage 12 substitution. So 5 group and 3 individual TSF sessions replaced the same number of TAU sessions. And then for the therapist sample, so 106 therapists at study sites were screened for the following criteria: credentialed to provide substance abuse services, willing to participate, approved by the treatment program administration, willing to be randomized, and familiar with the 12-step orientation. So in the end, only 39 therapists met this criteria. Interventions. What interventions were used includes therapeutic interventions. So in this experiment, there were no interventions used. Measurements. What measurements were taking, e.g. psychological tests, brain scans, etc. So there were raters that used the 12-step facilitation adherence competence empathy scales, or TSF-ACES, to evaluate treatment fidelity in the study. So first one, adherence, delivery of specific treatment content; competence, the skill of content delivery; global empathy, the therapist's effort to understand the client's perspective; prescribed therapist behaviors that detract from general therapist skill and should not occur, such as excessive self-disclosure; and global session rating, the overall session performance. Methodology and purpose. How does the methodology relate to the purpose of the study? So this study hired experienced raters to rate all of the therapists on the same 5 scales. This was done to easily compare them to each other and deduce what strengths led to treatment fidelity. Results. Major findings. So what are the major findings pertinent to the study hypotheses? So I just put the hypothesis there again for easy comparison, but contrary to the hypothesis, therapists in recovery had lower treatment fidelity ratings than non-recovering therapists. Additionally, frequent use of a 12-step orientation was associated with lower treatment fidelity ratings. What other interesting findings emerged, if any? So therapists with graduate degrees had higher treatment fidelity ratings than the therapists without graduate degrees. Discussion. Status of hypothesis. So what is the status of the study's hypothesis? So again, the hypothesis, the study hypothesized that therapists with these characteristics would have higher treatment fidelity: being in recovery, being an experienced addictions therapist, frequent use of a 12-step approach, positive attitudes toward 12-step groups, and commitment to post-study TSF implementation. So while some portions of the hypothesis were supported by the study, some portions were not. This lack of complete support of the hypothesis was surprising to those working on the study. Implications. So what are the implications of the findings, practical and/or theoretical? So the study indicated that therapists with these specific characteristics have higher treatment fidelity. This includes graduate degree, less than 5 years of addiction counseling experience, and self-efficacy. Limitations. What are some limitations of the study? So the study found that several therapists did not accurately report the techniques they use in therapy, and the sample size of therapists was much smaller than anticipated. Suggestions. What directions might be suggested for further investigation? So analyze the therapy techniques of therapists in their everyday practice before analyzing them in a specific study like this, and then expand this pool of study collaboration to find a larger sample size of therapists that fit the specific criteria. In citations, and here is my works cited for the article, so thank you so much for watching.